very good evening or good morning or good afternoon, whichever part of the world you're watching this live or recorded. Uh, a very warm welcome. This is Dr. Manish representing Dentrack, and we are live on podcast today to probably interview one of my best teachers, mentors for last 15 years. The subject is dental implant education today, and it gives me great pleasure uh, to be spending some time. And for viewers who are listening to it, watching this, it's going to be a 30-minute, very special episode where you are going to learn about dental implants, education, mentoring, the power of getting a great mentor to actually do dental implant work, and understanding why some people succeed and have the courage to place dental implants, and why 80% of us actually just about start tiptoeing into dental implants but do nothing about it. So if you are listening to this carefully, if you're at the start of your journey for dental implants or you are at advanced level, it gives me a pleasure to invite on stage none other than Dr. Fadi Barrak, who is my mentor and who has been an expert in the field for so long. Fadi, absolutely amazing to see you today, and I can't wait to ask you my 5 questions today. How are you?
Manish, thank you so much for inviting me. It's an absolute pleasure to be on Dentrack. Thank you for the invitation, and it's an honor to be introduced the way you introduced me. That's very kind of you, very gracious. Thank you. It's an absolute pleasure.
For the viewer, just to let you know, in 2010, I had almost said to my wife Shilpa, who is a dentist, to say, I think I can do everything, but probably my career is going to finish. I can't place dental implants. Surgery is not for me. And we said, let's invite a visiting specialist. And I Googled I Googled basically, and I said, visiting specialist for dental implants, and up came a site. I'm pretty sure the site is still there, called as Visiting Specialist Services. And I knew nothing about it, but I knew one thing, that this person looks trustable. And I gave a call to Fadi Barrak, and Fadi came on call and said, okay, I'll come and do some implants. And that's where my journey started. It was a 1 year of me being with Fadi doing implants for my patients. And then I got the energy to say, okay, Fadi, I'm going to come on your program, which is the VSS Academy program. That was 2011. And I am fortunate, privileged. In 2024, 80% of my diary is dental implants. And Fadi, thank you for that, for the education, for the training and the mentoring so far. Okay, so that's my story. So without much ado, I just want to give you that first question, Fadi. And it's related to dental implant education. And I want to understand what inspired your focus on dental implant education, and how has your journey changed as a teacher from, say, 2009 till 2024? I think that's the 16 years. How has the teaching changed? How are the students learning differently? What has been your journey? So if you give us a brief about your journey and your teaching journey, that's what the audience wants to listen to. Over to you.
Sure, of course. So I think my journey in implant dentistry, if I can start there, if that's okay, started in 1998.
Okay.
I was actually not in teaching. It was in implants. I started implant dentistry when I was a medical student going around doing oral surgery implants. And it's relevant because at that stage, patients hadn't heard about implants. When I started getting confident with implants and so on in early 2000s, I went around placing implants. But it came to a stage where colleagues wanted to learn how to restore. So I would place, and I started mentoring them for restoring. And that started like on a one-to-one basis. And sometimes it was an interesting journey being with senior colleagues who I had to convince that implants are good. In those days, I had to convince my colleagues implants are a good thing to get into. It's hard to believe today. But it started from there. It was a one-to-one training as a mentor for the restorative aspect. And then it gradually grew. So we started having a small group meetings. Our first small group meeting was actually at the BDA building, and that showed that actually there is a need for that. People are hungry to learn about implants, and it gradually developed through that to put a curriculum together. So I started teaching with the ITI the international team for implantology on their courses, and I developed my own certificate course, which you know about, which that really started in 2012.
Yes.
And so it gradually involved that. What kind of structured the courses was, first of all, at that time there were some guidelines. There were very early guidelines which really still stand. They got updated over the years, but in essence, in the UK, they're called the training standards for implant dentistry in practice. And that was a benchmark that I used. I also used the ITI education. I also used the Royal College of Surgeons. So I used all of those to find benchmarks, what should be in the course. Most importantly, though, being 14 years from when I started in implantology, the way the course, I shaped the course was thinking, what would I have wanted to be, what would I have wanted from a course when I started out? In those days, in the late 90s, early 2000s, there was only one course, which was the Guy's Hospital MSc. It was once every 2 years, full-time by the great Professor Palmer. Nothing else around at that time in terms of formal training. So that was how it started. It went from one-to-one to small group, actually a full cohort of 12 people, teaching them what I thought I would have liked to learn when I started out, what I wanted out of the course, but also making sure all those benchmarks are hit with that. And then from then on, it was gradually moving with the advances in education, advances in technology development, and feedback from colleagues, not least from yourself. I learned a lot from you, Manish, in terms of everything, really, how you run everything. I learned a lot from you as well. So it becomes a joint learning experience.
That's kind. And I think that you've explained a little bit of my second question, actually, and I would like you to walk me through once again for the viewers or the listeners to understand as well. What are the key elements? Say, for example, I am now actually trying to find the right education program for my learning needs. Yeah. And my learning needs can be different from Dr. A and Dr. B, or dentist A and dentist B. So the key elements which make an effective implant education program, how do you actually evaluate its quality? Because people are going to Egypt, Europe, Turkey, India, UK, VSS Academy, XYZ. What is that effective? What are the key elements, what we should be evaluating as a student when we go on this program? What would be your suggestions on that?
That's a really important question, because there are more and more courses coming up all the time. And I think the key thing is there are a number of things really a course should have in my mind, apart from what I've mentioned already, which is having benchmarks. Does the course meet the requirements to be enough for something like what in the UK, the General Dental Council considers as a guideline. So that's one aspect. And that's out there for people to check against the course's curriculum. So if you can't see what the course's curriculum is, or you can't find out what's on it, that's already something that you need to find out. The second thing is, it needs to be applicable to your practice. In other words, it can't be just knowledge base. You need to have some clinical components to it, which is why we've worked very hard to get a good clinical component on it. It needs to be up to date and with a faculty that is evidence-based. So what I mean by that is, you've got people on the course. So what we've done over the years, we've developed a faculty, and I used to teach most of it, if you remember, in the early days. Now I get different colleagues teaching different bits. So none of us can keep up completely up to date with every single aspect. So I get different colleagues teaching on different bits. It's more interesting for the delegates anyway, rather than just to hear one person, but also it keeps all of us up to date. And the evidence part of it is important, because it's not about somebody saying, this is how I do it. Mm-hmm. That's important, but it's also, this is why I do it like that. So I always say is, what we like to do is give. This is what I learned as a medic when I was a lot younger at medical school. I remember my gynecology consultant was teaching us. She said, you have to have the why gene. So always ask why. It's not about knowing how you do something. Why do you do it like that? And can you get out of trouble? So it's not just about learning, how do I do it? Why do I do it like that? And how do I get out of trouble? So the course needs to have that overall holistic approach. It needs to have the clinical aspect, and it needs to have the evidence base with a varied faculty, and of course meet the requirements.
Yeah. And very importantly, when we were speaking a while ago, there was a sort of a discussion about people learn differently. And you mentioned a very important point to say, yes, people learn differently, but there are certain steps to do for everyone, which is sort of the benchmark. And I think you mentioned now with the evidence-based protocols, different faculties specializing in different things and going through a process which is learning based, visual learning based, theory based, sort of shadowing, watching a few things, making sure you're asking the why. But two important things which I have learned over 15 years from you. One is why you're doing it, and diagnosis and planning to make sure it's correct. Yeah. And things have moved on with digital planning and the analog planning, which we used to do in 2010, 2011. But the most important thing is what to do if at all it's bad luck and things go wrong. And I think the most important part of your education as well is to show us, because I remember a big day we did, and I'm trying to remember the surgeon's name who came from Europe, and the whole day was about just complications. And when you're not expecting it, and how complications can be managed. So remind me the name of...
Jose. It was Jose Zurdo, fantastic
Yes,
faculty
yes.
member. He's a lovely chap and is a fantastic team member. Yeah. So,
Yeah.
sorry, go on. I mean, I can expand on that if you don't mind, Manish. So yeah, in essence, yeah, the complication is very good. It's not to scare people, but to say, look, they happen. It's life, you know. And I actually say this to patients as well. I look at them in the eyes and say, nothing in medicine and dentistry is 100%. I wish it was. And we have to be honest, you know, the honesty is important. But I think the other thing about the educational thing that you touched on, Manish, is the different types of learning. So what's I've looked at this over the years, and I've changed things around over the years. Again, looking at what educational evidence is, talking to professors in education, asking them, what are the best ways to teach? What is the evidence? What are the best ways to assess on a course? And what we have is a blended learning, meaning that, for instance, we don't just use one of those methods of learning, as you were mentioning, Manish. We have a multiple different ways, whether it's visual or manual or reading or taking notes. It's a combination of these things that help everybody be able to learn. And all of us at different times, we're not just fixed in one type of learning. Different times we like to use different methods of learning. So our blended learning involves, for instance, a very brief example, we, instead of what I used to do back in 2012, stand up, lecture for the morning, and then we do hands-on in the afternoon. And that was it. Now what we do is actually everything is videoed. So we record the lectures, so people can pause, rewind, start again, and it's the kind of short lectures you watch at your own comfort when you want. In addition to the lectures, there are some articles to read related to that topic. Then there are some questions we ask people to answer related to that topic. Once all that is done, we meet online on a live kind of webinar type meeting where it becomes a discussion. So we go through each question together as a group. And that really reinforces the knowledge, reinforces the videos people have watched, the papers they've read, and the questions they've answered. We just go through it to make sure the understanding is correct. And I found both from the exam results, but also from the feedback I've got from colleagues that they prefer that method. It helps their learning better.
Absolutely. And case-based discussions, reflections, actually putting a pen to paper or putting your fingers to the keyboard, let's put it this way now, and reflecting and having those peer support. Because I remember, and obviously I've seen a few more batches later on, each one of them actually presenting the cases, helping each other in the diagnosis and planning, and getting the mentoring throughout the year. That was a very core part for our learning. It brings me to my next question, which is the crucial one. And this is where students sometimes hesitate to invest, because yes, it's a substantial investment of £8,000, £10,000, sometimes £30,000 if they go for the MSc with the UCLan. Correct me if I'm wrong. And sometimes what happens with students is, am I actually going to do it? The fear of, what if I invest and not do it? And my question is related to that, to say, what are the challenges practitioners face to integrate implant dentistry into their practice, and how can education help? Or what have you seen with the 80-20 rule to say 20% are successful because, what are the traits of these students?
Yeah, that's as you know, there are those 80-20 rule, and there are barriers. So over the years, one of the big part of what we do has been trying to find out what these barriers are and find solutions for them. That's been one of the challenges for us, because what we don't want to do, what we've never wanted to do, is provide a course just for the sake of doing a course. Yeah. The aim of the course is for people who want to carry on and get involved with implants. Occasionally, somebody might say, you know what, it's not for me. Okay, that's fair enough. But the ones who do want to do implants and struggle, the common barriers, the common challenges, as you said, Manish, are, some of them are confidence. Okay, and I can cover these as we go along. Other things are actually having the support outside of the course and going forwards, because you don't know what's going to walk into your door. The course can prepare you. So the idea of the course is this: we take the delegates through the strong foundation in understanding implant dentistry, understanding getting people through the three major milestones: treatment planning, case selection and treatment planning, which is absolutely crucial; the surgical environment, not just placing an implant, how to actually manage the whole environment; and then last but least, the restorative and maintenance aspect. A lot of the problems come from the lack of maintenance or poor restorative techniques. So those three milestones we take people through as a foundation. But after the course, or at some stage, a patient with a kind of completely complex, full arch, full mouth problems with pathology and medical history, complex medical history, can walk through your door. Now, courses can prepare you, but when you're on your own in a surgery, it can be difficult. So the key things for me is, one of them is having the confidence will depend on a number of things. First of all, the clinical aspect. Secondly, having a good mentor that will support you, who will support you. A good network, a network of people that work together and have the similar mind, but also not just from the clinical aspect, the confidence to speak to a patient about the treatment. And that comes from somebody, actually, to be honest, you know better this much better than I do, Manish. It's about kind of training people to be able to present a case in an honest way without pushing them, but actually being confident about what you present. So they take on, basically, I'm talking about treatment conversion.
You mentioned that, Fadi, and thank you for the mention. And for listeners or viewers of this podcast, I usually say there are 9 very important questions to ask your patients while doing the case selection, diagnosis, and treatment planning. So obviously, my number will be on the screen. If somebody is listening to this, it's 0770-372-4664. And I'm on behalf of Fadi and me, there are a couple of templates which we would like to give you. If you are keen to understand what these 9 questions are, very, very happy to send it across as a DentTrack resource. I'm pretty sure there is one very powerful resource which Fadi wants to share with you around diagnosis and planning, which we will send across as well. So all you need to do is send us a text message, a WhatsApp straight to me. 0770-372-4664. And as a gift or as a thank you for watching this podcast, we would like to send you two very important documents. So feel free to touch base. Okay. So going back into what Fadi was saying, the treatment conversions or diagnosis and treatment planning. And the question was, what challenges practitioners do face? And I think there are two challenges mainly, which Fadi has just said. One is actually right case selection, diagnosis, and planning. If you can't do that, if you don't have the lateral thinking, that's number one. And if you don't have the right communication skills and actually helping your patients to take the right choices with your own ethical sales or communication skills, as we say, as my mentor Ashley Latter calls it, ethical sales and communication skills, then you are actually compromised. You can't develop your dental implant practice. Would you agree, Fadi, with the combination?
Absolutely, absolutely.
Yeah. So in effect, next it leads to the next question to say, how does VSS Academy actually work with the students? So do they start coming and shadowing you, or do you go into mentoring? How does the process work alongside the actual academy education stuff? What's the ongoing support to the students?
So the ongoing support is, one is having the clinical components. So we go from, let's say, models to pig's heads to clinical cases, and then having the supervisors on courses that can become mentors. At the same time, we have the VSS Academy network. We have a lovely, I'm so lucky to work with a wonderful bunch of colleagues, faculty who are always there, happy to support. And we also have regular, for instance, the fourth Saturday of the month, we have a regular kind of, we call it coffee conversations, where people can come up. What we do, they can present cases. They say, I've got this case, I want some advice, and we can just chat about it. We also at the same time go through a bit of fun way of going over the latest research. We discuss some latest research that is of interest. So that network is important, because one can get isolated very quickly. Only recently I had a colleague who's taken over a list from somebody who's really struggling with difficult cases, and they were feeling very, very isolated. I said, look, you've got the network. They just started the course. I said, use the network. We're here to support you. So those are the things that can give one confidence to get involved, and not to kind of finish the course and then for months do nothing. That's when it becomes harder to start. You need to start using the network, using your mentors early on.
Absolutely. And leading on from that, what Fadi has said, what I have realized over 15 years, being in the network, being connected to Dr. Fadi, Barrak, Dr. Manoj, there are a lot of people within the VSS Academy, is sometimes it's just a phone call away. Sometimes it's just a WhatsApping of a quick CT scan or a picture or something to say. I had this recent one with Manoj, where who is one of your tutors, and Dr. Manoj said, I have this case where I've done the prosthetic. It looks fabulous. X-rays look great. What am I missing? Because patient says there is some kind of pain. And it was a very simple solution. And that came because of the experience with Dr. Manoj and being with you and UCLan and Preston and everything which he has done. And I thought, oh, never struck me. So sometimes being in that isolation to say, I know everything can be a problem. And the kind of love and things you have spread across with the network, I'm pretty sure any part of UK or even now in India, are there some students in Europe? I don't know, but there are a lot of network out there who can help. So if anybody is listening to this and you think, okay, I want to join this network, I want to be in the academy, but can I go and observe somebody? I'm pretty sure Fadi can pick up a clinician, a clinic anywhere in the UK and say, what's the closest? Go and watch with this. Would that be right, Fadi, to say for somebody to start?
Absolutely. Yeah, absolutely. We've got training centers across the UK, from Aberdeen all the way down to Kent and the West Country. So we are, as I said, we got lucky to have a large network, and they're all happy to kind of help with shadowing and so on. And I'm glad you mentioned Dr. Manoj Bhatia, wonderful clinician. I'm so glad you introduced me to him. He has mentored and helped so many colleagues, so many of the delegates, and he is very well known in the UK. I'm sure he's in India as well because of his help. Yeah.
On that note, with India, Is it right that you are accepting students from India next year to join on the UCLAN or the VSS Academy program? Could you elaborate a little bit on that as a quick one? Because I'm pretty sure a lot of Indian dentists are watching this podcast. Anything for dentists in India?
Yes, correct. So we are hoping and very excited about starting the courses in India and recruiting from next year. The idea is to provide the course in country. As I said, a lot is blended learning, so a lot of the same faculties, the same teaching that's happening here, and the clinical component will be in India with training centers in India that will be approved by University of Central Lancashire. And yeah, so watch this space. We can forward more information with you. There will be some. There's a website you can actually link to and take any information you want. And please don't hesitate to contact us. I think the man to speak to is Alan Goldie. The website you'll see.
Yeah. On the screen, there is vssacademy.co.uk. Obviously, my number is with you guys. I can connect you with Alan, who is the MD for VSS Academy, and obviously Fadi will be guiding us all. But as we are on this podcast, if anybody needs help, and I know we are heading towards our 30 minutes, we are 3 minutes away from closure of this podcast. I have this final question, Fadi, for you. If there is a new practitioner sitting anywhere in the country, what's the best advice you can give them about dental implants? And think of me 15 years ago who had decided I will finish my career, but I'm not going to place dental implants. What is your advice to these new practitioners about dental implants? What is that game-changing, life-changing thing about it?
Okay, well, I might be a bit biased, as you know, Manish, but I would say, look, test the waters. You won't know until you test the waters. But with what we are offering you between yourself, myself, and VSS Academy, we can offer a testing the water in a safe environment. So, you've got the support to make sure everything done is in a safe way, is in a proper way. And I would say go for it. It's a very exciting area, not just because it involves restorative work, occlusion, perio, surgery, and digital advancing fast materials. Every aspect of dentistry is a fascinating and fantastic area. From the business point of view, patients want it. As I said earlier, when I started, patients didn't know what implants were. Now they come wanting implants. So if you don't provide implants, you might be falling back, actually. So I would say it's a service, one way or another, that should be provided in the practice. The other thing I would say is when you start, find a good network. Have a good support network, both from the business aspect, coaching aspect, from the clinical aspect, mentoring, and be patient. Don't try to kind of go all the way to the very complex things straight away. Start with a good foundation, develop over time, and enjoy it. It's a very exciting thing. I can't recommend it enough.
Absolutely. And as we're closing on to this podcast, I just want to say to the viewers and listeners, this is the best way I describe a dental implant to a patient. It's a 60-second pitch, which I do. And I would say that if you listen to this for 60 seconds, and it's not me, I've been trained by top sales people to say the 60-second line. So what I'm going to share now is probably our concluding tip to say, if you want to speak to somebody tomorrow about dental implant, this is what you say. I'm going to say, Mr. Smith, dental implants is the closest you can go to a natural tooth. You can smile with it, you can eat with it, and you can clean exactly the way you do your natural teeth. What it means is your confidence will be super high because these don't move. They look like your natural teeth, and you can smile absolutely with confidence. You can eat healthy. You can have a better kind of a health because you're eating well. And most importantly, you can maintain your mouth hygiene much better, just like flossing, brushing, cleaning. So almost we're reversing things for you to get you exactly what you had before, but obviously with a fixed artificial tooth, and that's dental implants. How does that sound? Would you like to proceed? And trust me, when I changed my language with this, and I devoted to Ashley Latter, my selling coach, and I'm going to highly recommend Ashley through this program as well, to say, if you haven't been on this program of how to speak to patients, please do. So that's my concluding line. I know Fadi has a long journey after this recording to go. So Fadi, absolutely great 30 minutes. There is more to do, and I'm pretty sure there are more questions from the audience. So I'm going to say, please connect on to VSS Academy. As it says, their tagline is unlock your potential. You all have that potential. You just need that first step and courage to ask for the right help. And I'm absolutely recommending this team at VSS Academy. So thank you so much for giving your time to Dentrack team today, Fadi. I am going to thank the backend team of Dentrack, Dr. Rajiv, Samantha Martin, Dean Hutton, who have been very helpful and instrumental to do this. And I'm going to leave it to them to do their closing slide for this video. And absolute pleasure to finish today. Thank you so
much.
Thank you, Fadi. Take care.
You too. Thank you.